Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today, doctors break the silence on risk and misinformation. In a healthcare climate that is filled with uncertainty and confusion, we need to listen to the voices of reason, the doctors that care for us. Dr. Robert Schreck and Dr. Donald McFarland join us to share some insights on issues of the utmost importance. They are among the most highly respected members of the medical community. We are fortunate to have them here today. And let's meet our guests. I welcome you. And starting with you, Bob, please share a little bit about yourself for our viewers.
Bob Schreck, private practice, medical oncology for the last almost 5 decades here in Des Moines. I should point out before we begin, I've been a member of the Iowa Medical Cannabidiol Advisory Board since its inception, still am. However, anything I say today represents my own personal and professional opinions. I do not speak for the board.
Excellent. Donald?
Yeah, I'm Donald McFarland. Hello, everybody. I am a retired professor of hematology oncology at the University of Iowa. I think for 4 decades, I'm not sure if I can quite match your 5 decades, Bob, but seems odd that we've got 2 hematologist oncologists joining together in a panel. I've been doing various things. At one point, I was the chair of the Iowa State Board of Health, and I do various things politically and artistically and everything else. And I'm raising a family with 9 grandkids, so my life is sort of fairly full at the moment.
Well, you raised an interesting point, whichever one of you want to address it. What makes it so important now? I mean, actually having a hematologist and oncologist available has a lot of bearing on what's happening with issues today.
I was talking about this the other day with someone. The thing about hematologists is that they're very often dealing with very sick patients, with rare diseases, with a very uncertain management. So hematologists are basically very much inquiring. They want to know, they want to understand, they want to build their practice on a basis of knowing and understanding, not necessarily following the guidelines. There may be no guidelines for the disease that we're treating. And so hematologists tend to be more inquiring, more generally knowledgeable than most other physicians. Bob, is that right?
I would agree 100%. Cancer goes everywhere. I'm more of an oncologist than a hematologist. So we deal with everybody. We deal with men, women, old, young. We don't do in our practice pediatrics, but it does require us to deal with other specialties, other doctors on a regular basis for their assistance and their input. So again, it's a very broad-based area of, quote, specialty medicine.
So now, having chatted with you before the show, we've had if anything, a degradation of science and medicine in this sort of healthcare climate that we have today. And it absolutely amazes me that there are credible doubters of what medicine has done for human beings. What do you think in today's climate are the most important issues that you would want to bring to the table today?
Well, I've heard about misinformation. I've heard about the assault on our probably our medical experts from around the world, from CDC, the negative things said about the way they handled the pandemic and so forth. And I'm sensitive to those things, but on a very real basis, day by day, in practice, I don't really see a problem. Patients for years have trusted us to do the best for them. They don't always agree with what we recommend or want them to do, but they're willing to listen to what we have to say. I've seen no change in the daily administration of medicine in practice at all, and no degradation at all. Don?
Well, I absolutely agree. I think there's more information now. The quality of clinical trials has gone up enormously. We've got all of these wonderful new drugs in oncology, new mechanisms of action, difficult to use, but spectacularly good outcomes. So it's been not the age of disinformation. This has been the age of information. We have had an enormous increase in the amount of specific believable knowledge that's being generated and used. At the same time, there is a very vigorous expression in public of a lot of things that people believed in private. So a lot of people were anti-vaxxer in private. A lot of people were into some sort of voodoo medicine in private. What's happened now is that those people's voices are being joined and are being broadcast very noisily around the world. But much more effective, though, is the amount of sensible, proven knowledge that is pouring into the medical sphere. So yeah, there are some problems. I think I thought that COVID was really very interesting. The medical practice of COVID was pretty good, given the sort of emergency status of it. But the practice of administrators and politicians, I think, needs to be changed. We were told that we couldn't discuss certain items, that we had to go along this. We walked into the hospital, we had to wear a mask. You were not allowed to say to the hospital administrator, why are we all wearing masks? Where's the data that masks actually does any good? So all of that spirit of inquiry and questioning was suppressed during COVID. The practice of medicine was just fine, but the response of administrators and politicians, I think, leaves a lot to be desired.
Well, let's take a break right now and talk about that when we come back after the break. We look forward to continuing our conversation with Dr. Schreck and McFarland. Stay tuned. We'll see you all after the break.
Well, because it's the best. And that's true, because I've thought about that. I mean, definitely the fastest. And the biggest thing I hear most people talk about is the stability of it.
Mediacom's network is very reliable. We have a lot of programs in place that can monitor kind of issues that arise. That way we can fix them before they reach the customer.
Trust the pros. Get Extreme Internet starting at $9.99 a month for a year.
Watching MC22 is now easier than ever before. All Mediacom customers can watch local programming online anytime. Go to mc22.net, click Watch MC22, and log in with your Mediacom account. Not a Mediacom cable subscriber? Mediacom internet or phone subscribers can watch too. Your local programming leader, MC22, online at mc22.net/watch.
Welcome back to Surviving Bad. We're speaking with Dr. Schreck and McFarland about some issues relatively in flux, meaning that what we all do today can influence the future for better or worse. And there is a topic of cannabis, which is extremely difficult for the average person to discern in terms of health risks, benefits, and safety. And on this, we have two very powerful experts in the room. Let's see what they have to say. Bob, let's start with you.
Well, having been on the committee for 7 years, I've seen it evolve in a very specific direction. In Iowa, we have a unique medical cannabidiol program, cannabis program. First of all, it's composed of professional medical people, 1 pharmacist, 6 physicians, and a law enforcement officer. There's only a few other states have this sort of professional level. We also have had the privilege of the Iowa legislature giving us a great deal of credence, a great big voice. In fact, they've really agreed with everything that we've asked them to do. They've come to us for advice. We've given them advice. We've crossed on a few issues, but they've eventually gone our way. And what we've done is we've created a program here that enables any Iowan with an underlying condition, that's a short list of them, to try medical cannabis, to see, first of all, if it's going to work, and to try it in a situation where it's produced and manufactured by a very responsible organization without any pesticides, toxic metals, in a known dose and a known administration technique. We're very proud of that program. It's also quite limited in the amount of tetrahydrocannabinol, or THC, that you can actually purchase, which is one of the criticisms of our program around the country. But from us, that's one of our points of pride.
And we talk about that, and we always hear about dosage and potency, but yet what we hear in the news is that the providers are wanting to increase dosage and potency, even to the point where I thought they were introducing something smokable again in Iowa.
Well, when you
Which
say
we pretty
provider,
much have, I thought we were all in agreement that that was the absolute worst way to try and take anything in the form of a quote unquote medicine.
but when you say providers, you mean the manufacturers and the distributors, not the medical providers.
Right.
But
The manufacturers and distributors. Absolutely
there's
correct.
been a bill every year for the last 3 years in the Iowa legislature. There's one this year as well, promoting raw dried cannabis, which is leaf or flower, as a form of medical administration. That's not gone anywhere in the past, and hopefully it will not this year as well. The board is opposed to it. It's published its opposition to that legislation, and hopefully it will not pass. Nowhere in the world do we administer a medication by combusting it. The products of combustion are always dangerous for the patient, regardless of the chemical you're trying to get at. So I think that's a no-brainer and a non-starter for a medical program.
Well,
So
that's good to hear.
I really come at this topic from the point of view of a skeptic. So hematologists, oncologists naturally are skeptics. We hear that eating carrots is good for cancer. Well, it isn't. So don't eat carrots. But if you want to eat carrots, that's just fine. So my approach to cannabis is, first of all, what is it? Well, it's basically two compounds. There's tetrahydrocannabinol that makes you high, and CBD diol, which, I don't know, does it make you high? I don't know what it does. And it's widely smoked by people who want to alter their minds. They want to think differently. They want to emote differently. One of the problems with mind-altering drugs, that's primarily alcohol, tobacco, and weed, and then hard drugs, is that they don't solve the problems in the world. In fact, they make the problems worse. So the major problem that I have with cannabis, not from the point of view of an expert, but from the point of view of a casual observer, if a young person smokes pot, fails a university exam, doesn't get on the football team, it gets dumped by his girlfriend, his future life is degraded. And there's very little doubt that cannabis can do all of those three things. So cannabis for young people, I think, can be a disaster for a career. True or false? One of the things that people say, well, maybe the failing the exam causes the person to smoke cannabis, or maybe smoking cannabis causes you to fail the exam. So cause and effect is almost impossible to turn out. The problem that I have with this is the concept of medical cannabinoid. So if you look at the bill, it's labeled, in fact, I've got it here, I can show it to you. I'm not sure you can read it, but there it is. It is the Medical Cannabidiol Act. What is a medical cannabinoid? Does it have a valuable property? Can it cure a disease? Certainly not. Can it ameliorate symptoms? Not very well, not well enough to be licensed by the FDA. So you've got a drug which is labeled by the legislators as being medical, when the medical profession doesn't think of it as medical. We think of it as recreational. So I would like to see one aspect of the bill changed, and that is the use of cannabinoids for pain. I don't think there's good evidence that cannabinoids are very valuable in the management of pain, not as valuable as, say, Advil. So why do we have a state program that hands over cannabinoids to patients who complain of pain when the medical profession doesn't think it does much for pain? So that's my view. It's a tough view. And as I said, this is more a sort of middle of the street attitude rather than a deeply researched and knowledgeable opinion.
Well,
Now,
Don,
both of you deal with many cases that have essentially a terminal impact on somebody's life. It can kill them. And these are diseases and things that happen, and it's very traumatic. But we see a proliferation of people self-medicating for various and sundry reasons. I mean, everybody's got their reasoning for that. Is there an underlying sort of, from your experience, if I'm really sick I have cancer. I don't question the need for doctor, and I don't look to how do I self-medicate? Okay, how do I cure my cancer and go online? I want to immediately go see a doctor. Whereas it's probably where I found out that I had cancer. If somebody is driven to these things, and we have this large basis of both recreational and people that are self-medicating, is there some underlying symptom? Is it anxiety? Is it hypertension? Is there something going on in people's lives that opens this portal to believing these unscientific sort of options for dealing with the quote unquote pains they have?
Well, we'd like to think that everybody behaves rationally. And of course, they generally do. That's why we survive and get through the day. And when you develop, let's use cancer as an example, as you have, you develop cancer, you'll go to a medical oncologist, you'll hear what he has to say, you'll think about what he has to say, what he has to offer. If you don't like what he has to say, you'll ask for a second opinion. Of course, what they really want is a different opinion, which will then extend to them. At some point, some patients who find that medical science does fail them in what they want, which is a cure, will turn to other alternatives. They'll leave the country, they'll go to Mexico, they'll try something someone else recommends. That's human nature. There's a little bit of desperation and a great deal of hope. I think that's just a very normal human thing to do.
All right, let's take another short break. When we come back, we're going to continue this very interesting conversation with Dr. Schreck and McFarland. Stay tuned. You don't want to miss this.
Watching MC22 is now easier than ever before. All MediaCom customers can watch local programming online anytime. Go to mc22.net, click Watch MC22, and log in with your MediaCom account. Not a MediaCom cable subscriber? MediaCom internet or phone subscribers can watch too. Your local programming leader, MC22, online at mc22.net/watch.
You told me not to talk to strangers. You told me not to cross the street without looking both ways.
You told me not to touch the stove.
You told me not to do drugs.
You told me not to drink and drive.
You gave me so many messages about how to stay safe. Why didn't you keep me safe by properly storing your gun?
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking about some risks of cannabis that media has essentially been used to minimize the risks of. And in Iowa, in the face of strong pushback from the medical community, not true all over the country necessarily. Dr. Schreck, why aren't people listening to these warnings?
Well, first of all, I agree with everything that Dr. McFarland said about cannabis and the skepticism that he exhibits. However, I think our program, our medical program, has some features that are redeeming. First of all, we do not believe that euphoria, getting stoned, getting high, has any role whatsoever in a medical program. You do not need to achieve euphoria to get any of the putative medical benefits of THC or of cannabis. In fact, the doses that we are limited to, if they take them as prescribed, they will not get stoned. If you take medical cannabis and experience a high, you've overdosed. You should back off of what you're getting and what you're taking. Second of all, for most people that try medical cannabis will be disappointed. It's not going to work. It's not going to do what they hope. They have great hopes. They go in there with great hopes. In fact, I'll go so far as to say the vast majority will be disappointed. But there'll be a small fraction, maybe 20, 30%, where they seek some benefit and they find it. For those people, they can now purchase the drug, purchase the substance, I should say. Again, a known dose, honestly manufactured, free of adulterants, for a specific amount of money, and they can continue that as long as they wish. Dr. McFarland is right, it doesn't cure anything. Antibiotics cure infection, chemotherapy cures cancer. Cannabis doesn't cure any disease whatsoever. It does provide relief of symptoms, much like the Advil that he mentioned, but only for a few hours. Then you have to take it again. Not because you're addicted, but because your symptoms come back. So it's there for folks who want to take it and try it. Our doses that we supply in our program are metered. They can microdose. They can give small amounts through the course of the day. Do so, get any putative benefit, and not experience euphoria.
Now, you say euphoria, which has obviously some relaxing sort of intonations. But the fact of the matter is that euphoria you're referring to can also inhibit people's ability to reason, to judge distances, to drive effectively. I mean, this is a signal of extreme risk when you take any medication, but this substance would have that as well, would it?
If you take enough of it, it will be mind altering. That's correct. And it may be that the CBD portion, because all of our products that are available are combinations of THC and CBD in varying concentrations. It may be that the CBD is, in a large effect, the main pain relieving effect of this compound. But the two together actually seem to have some advantage.
But looking at the state sales records through the dispensaries yesterday, I noticed that the largest percentage of purchases are the high THC
Vaporized.
euphoric ones with potential euphoric side effects.
If you take your 90-day supply of THC and use it all up in the first week, yeah, you'll be euphoric. If you spread it out through the 90 days, you will not be. The medical program is encountering some problems. The problems come from the ready availability of hemp, which was not only a federal law in 2018, but also a state law that allows hemp products with THC to be sold without restriction. Say without restriction, you can buy as much as you wish, but the product you buy is limited in its concentration and the amount. Doesn't limit the amount you can actually buy depending on how much money you have. It also has the advantage that you can write a check or use your credit card to buy hemp. To go to a medical dispensary, it's cash and cash only. That's because of the federal law still prohibiting medical marijuana.
Dr. McFarland, your thoughts on this?
Well, I'm really anxious for people not to use mind-altering substances. I think my wife would like me to quit my glass of wine with dinner every night. I think wiping alcohol off the face of the planet, after it happens, we'd be very happy about it. Same for tobacco. I think we'd also be very happy if people didn't smoke pot, particularly young people. When you're 55, maybe it doesn't matter that much, but for a 17-year-old, it can be a disaster. And I think that we as a society, nobody disagrees with that, by the way, we as a society should exert effective downward pressure on the consumption of cannabis, alcohol, and everything else, and hard drugs. It's hard to do that when the state of Iowa, using its legislative authority, has a medical cannabidiol program, because that is telling people, oh, it's good medicine. It's not good medicine, guys. Get rid of it.
All right, we're going to take a short break. And when we come back, we're going to ask you to share some final comments, insights, and inspiration for our guests. You guys have been fascinating. Let's see what we need to tell point on point to our viewers. See you all after the break. You don't want to miss this.
Get ready. MediaCom is now.
Mobile?
Well, not just mobile, but a 5G mobile network with reliability you can count on.
Really?
Just check out this map. Coast-to-coast coverage, plus hundreds of free extreme hotspots. It's an unbeatable network, and we've got some unbeatable prices, too.
But I love this phone.
Easy. Keep your phone when you switch. And guess what? You'll love it even more. MediaCom Mobile. Learn more today.
I don't remember how it started.
Go to that.
Oh boy.
Our back and forth. It always came back.
Dad!
You probably don't remember what you told me,
That was perfect.
but I heard every word.
Welcome back. Today on Surviving Bad, we heard doctors break the silence on risk and misinformation. Let's see what insights and inspiration Dr. Schreck and Dr. McFarland have to share. Dr. Schreck?
I, again, will relate back to Dr. McFarland's comments and his skepticism about about cannabis in general. I share that skepticism. I think if it's going to be used in a medical manner, it's got to be used in a very tightly controlled, low-dose manner that does not promote a market for euphoria. People need to have a chance to try it in a way that is safe to see if it's going to work for them. For the vast majority, it won't work. They'll stop spending their money and they'll move on. There is a small fraction that will probably benefit, and they'll have the opportunity to do so. But again, I'm very skeptical, along with Dr. McFarland.
So I think I'm more looking at the total program. That is, if we support cannabinoids medically and legally, we're degrading the ability of police officers to suppress the use of pot. One way to do this, I think, is to ask the legislators to discontinue pain as an allowable in the bill unless a good randomized control trial of our products has been published. So discontinue it in 3 years unless there's a good trial. How about that?
Well, that sounds rather interesting. Now, there's this component you talk about, 20, 15, 10, whatever percentage might benefit from this. But what are the risks to the other percentage in terms of addiction?
If they don't misuse the product, which of course they always could, misuse it, like I say, take the whole 90-day supply and consume it in a week, they won't become addicted because they won't experience euphoria. Euphoria is the addicting aspect.
And do you have a final comment for us, Dr. McFarland?
Well, I don't think cannabis is as addictive as cigarettes. I mean, people can't live for an hour after their due time. Or alcohol. Alcoholics have a terrible time avoiding alcohol. No, cannabis is career destroying, lifetime destroying. Your middle age, older age is going to be very impacted by what you do as a youth with pot.
I thank you, gentlemen, so very much for being here and sharing this message. Never enough time, but the power of your message will ring true. Thank you for being here. And thank you all for watching today. Check out our website, ahealthyiowa.org, and keep your eye on MediaCom MC22 for our next episode of Surviving Bad, where we explore stories of survival, hope, and inspiration. On MediaCom MC22, your local programming leader.